I'm going to call the meeting to order at 9:01, and I'd like the clerk to conduct roll call.
Sure. Good morning. Supervisor Brown.
Here.
Supervisor McCowan.
Here.
Supervisor Jurdy.
Here.
Supervisor Williams. Supervisor Williams.
Here.
Chair Haschak.
Here.
Thank you.
All right. I'm going to lead us in the Pledge of Allegiance. Okay. Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, I'd like to announce that in order to speak via telecomment, one must submit a speaker form online before 8 a.m. the day of the meeting. The link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website under Agenda and Minutes and Public Engagement. If you have submitted a comment request for either public expression or consent calendar, please call in now. Okay, so if there's any public expression, let's see. We didn't have any public expression forms submitted, so we're going to move on to the consent calendar, and I'm going to pull a few items for comment. That's 4B, 4E, 4F, and 4K. So on item 4B, I'd just like to say that, it's $1.6 million for the infrastructure for the microwave system, communication system, and this is a necessary component for our EMS, for our police departments, the sheriff's department, public safety, and so I just like to say that's the clarification for that item. On 4E, I'd like to congratulate Supervisor Jurdy in winning the primary, and so winning another 4 years on the Board of Supervisors. And I'd like Supervisor Brown to read the proclamation on Crime Victims' Rights Week, which is item 4F.
Thank you, Mr. Chair. This is a proclamation of the Mendocino County Board of Supervisors. Seek justice, ensure victims' rights, inspire hope. Crime Victims' Rights Week, April 19th through the 25th, 2020. Whereas the victims' rights movement has resulted in the passage of laws at the local, state, and federal levels that establish essential rights for victims, and whereas Crime Victims' Rights Acts passed here in California and at the federal level have provided victims with ways to participate meaningfully throughout the criminal justice process. Whereas advocacy by and for victims of crime is itself a form of seeking justice, no less than justice sought in the courts. And whereas supporting victims of crime is crucial to the U.S. justice system because our support honors the experiences of victims and allows them to find autonomy and empowerment through achieving self-defined goals. And whereas we must help victims access the justice, assistance, and support they need to rebuild their lives. And whereas advocacy by and for victims of crime is itself a form of seeking justice, no less than justice sought in the courts. And whereas the accomplishments of the victims' rights movement achieved through compassion and collaboration and built on the courageous advocacy of individual victims and their families across the country, inspire in us hope for future progress and greater healing. And whereas we are determined to respond to crime and violence by helping victims find not only support, recovery, and justice, but also a sense of hope for their future. And whereas National Crimes Victims' Rights Week provides an opportunity to recommit to ensuring that accessible, appropriate, and trauma-informed services are offered to all victims of crime. And whereas the County of Mendocino is hereby dedicated to strengthening victims and survivors in the aftermath of crime, building resilience in our communities and our victims' responders, and working for justice for all victims and survivors. Now, therefore, be it resolved that the Board of Supervisors of the County of Mendocino hereby proclaims April 19th through the 25th, 2020 as Crime Victims' Rights Week, dated April 20th, 2020, signed John Haschak, Chair. Thank you.
Thank you, Supervisor Brown. And I'm going to read the proclamation of the Mendocino County Board of Supervisors recognizing April 19th through 25th, 2020 as Volunteer Appreciation Week in Mendocino County. Whereas National Volunteer Appreciation Week, April 19th through 25th.
We're live, our eyes turn on, right?
Is a time to honor the thousands of individuals who take action year-round to strengthen their communities. And whereas during this week, all over the nation, volunteers will be recognized for their commitment to service. And whereas established in 1974, National Volunteer Appreciation Week has grown exponentially, recognizing the incalculable contributions that volunteers make every day across the country and challenging all Americans to step forward to help wherever there is need. And whereas the County of Mendocino's volunteer force of 379 is a great treasure, with volunteers giving over 13,360 volunteer hours to the Mendocino County community by assisting in county libraries, animal care services, the County Museum, Office of Emergency Services, and many county offices. And whereas National Volunteer Appreciation Week reflects our appreciation for County of Mendocino volunteers, and whereas the County of Mendocino Board of Supervisors encourages all citizens to volunteer in their communities, now therefore be it resolved that the Board of Supervisors of the County of Mendocino hereby proclaims the week of April 19th through 25th, 2020 as National Volunteer Appreciation Week in Mendocino County, California, dated April 20th, 2020, and signed by John Haschak, Chair. And I'd like to go call on Rebecca Enberg, who has a public comment.
Yes, thank you. My name's Rebecca Enberg, and I am the Program Director at North Coast Opportunities Volunteer Network. And it's my pleasure and honor to be very involved with coordinating the wonderful volunteers that you just spoke about. Of course, not everyone, but quite a few of our county volunteers are in one way or another associated with NCO Volunteer Network. So I want to thank you for taking the time and having a proclamation to recognize them. And I just want to add that during this unusual time with our COVID-19 shelter in place, it is just amazing how many people in our county are still wanting to volunteer and help in some way. And so we are doing our best at Volunteer Network to find ways that they can help if they aren't already engaged with a agency that they are particularly already associated with. And then I also wanted to just thank you on behalf, as a county, for providing volunteer opportunities for volunteers of all ages, because it's so important to be involved with volunteer experiences when you're young, because that often leads to a lifetime of community services. And we have found that the County of Mendocino, by having youth work, although they are supervised very well, but youth working in animal care services and in all the libraries is really doing quite a good job of engaging youth in volunteerism that hopefully will last a lifetime. And we're very thankful for that. And as well for the youth, I mean, volunteering helps them with their college applications and putting that on their resumes. And for seniors, it helps them to live more independently because they are socially engaged, and that tends to lead to a healthier and more satisfactory life. So I just want to thank you for that and let you know that we are working to keep volunteers engaged during this time of COVID-19 shelter in place. We are engaging our community emergency response team volunteers since they are background checked in home deliveries and those type of experiences, and also helping healthcare volunteers find appropriate placement where they want to help with public health. And I think that's about it. And thank you very much.
Okay, thank you, Ms. Enberg. All right, and we also had a public comment about item 4B from Anna Marie Weibel. Is Ms. Weibel on the line?
Mr. Chair, I only saw her email.
Right, but she also had called in for a telecomment. So.
Okay, thank you.
All right. Well, not hearing from Ms. Weibel, we'll continue on. Are there any other items that any of the supervisors would like to pull from the consent calendar? Hearing none. Okay.
Mr. Chair,
Yes.
this is Supervisor Brown. I move approval of the consent calendar.
All right.
Second.
Okay, it's been moved and seconded. Clerk, could you do a roll vote?
Sure thing. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
And Chair Haschak.
Yes.
The motion carries unanimously.
All right, thank you. Moving on to agenda item 5A, discussion and possible action, including an update associated with the novel coronavirus COVID-19, including possible direction regarding essential services in Mendocino County, including operational preparation and response, and an update on county continuity of operations and services. Sponsor is the executive office. And so what we will do with this is we will hear the presentations from the half a dozen presenters, and then we will ask questions. So supervisors, if you could write down questions and keep them in your mind, then we will take them all at once at the end. All right, so I'm going to go to CEO Angelo.
Thank you, Chair Haschak. Good morning, and good morning to the board and to the public. I will give a very brief report, as we have Dr. Dewan will be doing a health officer briefing, and then, of course, Deputy CEO Darcy Antle talking about our fiscal update, and then some other items that this board wanted to hear about regarding parks, testing, and shelter in place. So you will be hearing all of that this morning. I would like to mention two pieces of good news before we start our presentation today. One is that these are unprecedented times, we know, and FEMA has been working very closely along with the state, with the local entities in response, and they're doing everything they can to try to financially support the local entities that are responding to COVID. And so inside of 14 days, we received an approval letter from FEMA that we will get an upfront payment of $750,000, which is essentially reimbursement. And FEMA reimburses us 75% of what we're eligible for. And to get an approval letter inside of 2 weeks from FEMA stating that we would be eligible for a very quick payment of $750,000 is phenomenal. I would like to personally thank Deputy CEO Darcy Antle, who works feverishly and long hours to make sure that Mendocino County does the appropriate documentation and then sends that into FEMA so that we can get reimbursed. So good news story, money coming. We've spent obviously more than $750,000 so far, but this is a good first start as far as reimbursement from FEMA. Additionally, I would like to say that we have many partners within Mendocino County, and one of our most understated partner within Mendocino County is the City of 10,000 Buddhas. And we received correspondence from them and a call and an email that they would like to assist us in a way that we really could use assistance, which is with personal protective equipment. And they have surgical masks and KN95 masks that they would like to give to Mendocino County that could be used not only for our first responders within the county system, but additionally for our first responders within Mendocino County. So I'm very appreciative of our partners, the City of 10,000 Buddhists, and I wanted to make sure that the board and the public was aware. And I will be arranging with them for pickup this week. Additionally, within Mendocino County, a couple of the other services that we are providing today in response to COVID-19 that I want to make sure that the public has these numbers. We talk about the call center, and the call center remains open, and the call center number is 707-234-6052. And anyone from the public could call the call center, ask a question, give a comment. You could reach code enforcement through the call center, and you could get information for other county services. The county offices are closed to the public, most of the offices. You can make appointments in some of the offices. So if you have a service that you're in need of, you could call that department. If you can't get through, then you call the call center. But we will assist people in getting to county services, not only through the offices, but through the call center. Additionally, I would like to also commend Dr. Janine Miller from our Behavioral Health Department for very quickly developing and getting implemented what's called a warm line. And a warm line is a non-crisis support line. This is open 7 days a week, and this is manned by county staff. And again, this is a line where you could call and get a live person to speak with 7 days a week. I believe it's 8 to 7, and you could talk about whatever you need to talk about. And what we're finding today is that there are more and more people, due to the isolation of shelter in place, that have needs and are looking for people to talk with. And so the warm line is 707-472-2311. So as far as COVID, the number of positives, testing, I will leave that to Dr. Duhan and Dr. Flaherty. I would like to say that we are working with West Company regarding our economic downturn, which we are experiencing and believe we will experience over the next few months to a couple years. And so there will be more to hear around the work that West Company is doing with our Board of Supervisors and the business community. Our Emergency Operations Center remains open with our EOC manager, Lieutenant Shannon Barney, who has been with us from the beginning of opening the EOC and providing a great response and a quick response as needed. Staff continue to get trained within the EOC in this experience, and we have reduced the hours of the EOC, Monday through Friday now, 8 to 5, but we still have response 24/7 as needed. So with that, that is all that I would like to say right now. And Chair Hashtag, if okay with you, I would like to turn it over to Dr. Duhan.
Dr. Duhan.
Can you hear me?
Yes.
Okay. Okay. Tell me if there's an echo. I was having a hard time connecting through my computer. So I'm also, I believe, talking to you through my phone. So let me know if there's an echo, because sometimes that creates an echo. Thank you, Chair Haschek, Board of Supervisors, CEO Carmel Angelo, County Counsel. Thank you for allowing me to make this report today regarding COVID-19, both for our county and our region. I will give you an update. So we have now 5 cases of COVID-19 in our county. When I spoke to you last week, we had 4. And as you all know, we had our 5th case on Friday. This 5th case arose in a very concerning fashion, which created a great deal of, well, let me just say that it was very unfortunate for our county that this inmate was released early from Chino Prison, which is experiencing an outbreak at this time. The last news report that I saw, there were 67 cases of COVID in Chino Prison, and they released a group of inmates without testing them. And they also released these inmates early back to counties without there being good communication with the counties that released the inmates. I do happen to know, because of my close communication with the health officer from Sonoma County, that similarly there was an inmate released early to Sonoma County. I appreciate my colleagues in public safety, including Sheriff Matt Kendall, our Chief of Police Justin Wyatt, and our Chief of Patrol Chief Locatelli for lifting up our concern here in the county to the level of the governor and to the other leadership at the state, because this must not happen. If we have individuals who are COVID-19 released to our county in this way, it is extraordinarily dangerous. So I do appreciate the support from the highest levels to making sure this doesn't happen again if we are able to prevent it. But to the extent that we were able to respond locally, I will say that I greatly appreciate the coordination that very quickly on Friday was able to get this individual into a monitored isolation setting. And we are now monitoring this individual very closely, and he has remained asymptomatic, as well as his family member who he was initially staying with has also remained asymptomatic. So there are good indicators regarding at least the outcomes for these cases in terms of their well-being and us being able to monitor them closely. I do want to share what contact investigation means regarding this individual, and every case that we've had, we have taken on contact investigation, which means that our very strong communicable diseases team, and I want to call out today Sharon Condry, who is a very dedicated public health nurse in our county, who is leading up this communicable diseases team in our EOC. Her team will reach out to the case and ask them and interview them and ask them, who did you come in contact with? And then we contact those contacts and question them. So in the case of this individual, his close contact was the aunt that he was living with. We define a close contact as somebody where the individual comes into proximity of closer than 6 feet for more than 10 minutes. So if a person is walking down the street next to another person or is maintaining social distancing 6 feet away from another person, this is not a close contact. And this individual, we did get reassuring reports, did not come into any other close contact except with the aunt. So I will summarize that of the 5 cases that we've had in Mendocino County, 4 have completely recovered. And this 5th one is within days of the isolation period and quarantine for the aunt being up. And that each of these individuals, all 5 cases, have had acquired the disease, as far as we can tell, outside of our county. And all 5 have done well, not required hospitalization, and the testing that was done for them was done in a manner that was absolutely safe for our healthcare providers. I also wish to share that we do have a transportation plan in our EOC that goes into play when we have an individual who needs isolation and quarantine or quarantine that cannot do it safely in their home. And this would include homeless individuals, or it would also include individuals who, for other reasons, cannot safely isolate or quarantine in their home. This transportation plan, which I reviewed and was written through our EOC, specifies the acceptable methods for transporting these individuals to isolation and quarantine sites. And this is something we will be reviewing again in our EOC and with our incident commander, Carmel Angelo, to debrief what happened on Friday regarding the transportation of this individual. I do wish to share with you all that I have family members who are in public safety and in law enforcement, and I'm very sensitive to the issues that our public safety leadership has regarding the safety of not only our all first responders, but our public safety. And these are of absolute concern and utmost importance to me. And I look forward to being in close contact with our leadership this week regarding how we move forward with transportation plans. I do also want to share that I think we need to be aware of where we are in the greater picture of our ecosystem of the Bay Area in terms of this disease. So let me share that it's public information, the number of cases that are present in the Bay Area. These are cumulative cases. They may have recovered. So in the Bay Area, and I will list who I'm including in this definition: San Francisco, Santa Clara, Alameda, San Mateo, Contra Costa, Solano, Marin, Napa, Sonoma, and then I'm going to also include Mendocino and Lake counties. So if you include these Bay Area and what I call the greater Bay Area surrounding areas, there have been 6,318 cases of COVID-19 and 199 deaths. In Mendocino County, we've had 5 cases I've mentioned, no deaths, no hospitalizations. In Lake County, 6 cases, no deaths, and I believe it's 1 hospitalization. Sonoma County, 180 cases and 2 deaths. Sonoma County has community spread. Lake County, I was recently speaking to Gary Pace, the health officer. There is suggestion that there is community spread in Lake County. In our county, we still have the situation where there is an indication that we do not yet have community spread. And I want to speak to this in a moment. But the point being, we are surrounded by counties and an ecosystem of the greater Bay Area where there is community spread of this disease. And there was a study that was done last week of San Mateo County looking at what the number, what would be the essentially the indication of the cumulative cases that are in San Mateo County that we might not have detected. So in other words, they have reported in San Mateo 838 cases and 28 deaths, but there was antibody testing done to indicate what the actual cumulative cases are. And I'm sorry, I'm not expressing this very clearly, but the bottom line is we believe that in San Mateo County, 5% of the population actually has been infected with COVID-19, which would mean where the epicenter is of COVID-19 in the Bay Area, we are believing at this time that about 95% of the population has not been infected, which means that we still remain very susceptible in our whole greater Bay Area to having a surge and having widespread infections with COVID-19, which just brings us to the fact that sheltering in place, social distancing, the wearing of masks in public or facial coverings continue to be one of our strongest weapons right now against COVID-19. And these are all mitigation measures which we have in place now in Mendocino County. I also wish to say that there is a framework for limited reopening that is being addressed by the governor and by the Bay Area health officers. And this is regarding how we might have stepwise limited reopening of our communities by lifting the sheltering in place in phases. So as I've said before, we are not going to have an on-off switch with our sheltering in place. There is going to have to be phases. And in Mendocino County, we cannot be less restrictive than the governor. So when I'm asked about whether I would have reopening of different areas of our community, I can't do that until the governor is able to make his proclamations about what he is planning to do. And I do know that the governor has a good, strong eye on what the Bay Area is doing in terms of their limited reopening. And and none of the other health officers outside the Bay Area have information about what they're planning because they've gone into closed sessions in the large Bay Area counties about their plans. So we in Mendocino County are in a position where we have to wait. We have to wait to see what the governor's going to do, and we have to wait to see what the Bay Area is going to do before I can answer questions about what our limited reopening might look like, which we are anticipating to happen in early May. But in the meantime, there are things that we can do locally to address areas in the current sheltering in place order to help with it being sustainable. And before the Board of Supervisors, I did share what I'm thinking about doing at the end of this week, actually on Friday. I am considering a new sheltering in place order, which will have minor changes in it, but to try and help our rural community, our county, to continue to maintain this very important mitigation of sheltering in place. So the three areas that I'm looking at adding some relief to in the sheltering in place order that we have now, and my anticipation is this will come out on Friday. One is for allowing individuals to drive 10 miles from their home in order to participate in recreation. So a 10-mile distance from their home. So as many are aware, the last sheltering in place order said that to participate in recreation, people needed to take off from their house by foot or bicycle, or if they lived in a place that was unsafe to do that, they could go the shortest distance possible to recreate. So I am considering adding a 10-mile, that it is acceptable to drive 10 miles from one's home to recreate. The other is that, you know, in the governor's order, it is gatherings were banned. And for this reason, church services were banned by the governor, not by me. So in order to provide some relief, as you know, for a number of reasons, not just for faith-based groups, but for a number of reasons, in my last sheltering in place order, I allowed for live streaming of events that was not just specifically church services, but it was open to events that were meant to improve the well-being of our community and includes church services, could be live streamed with 4 people present in that live streaming event. And this was done in time for the religious holidays that were coming up, including Easter. So this was allowing 4 people to gather for live streaming because of the horrific outcome that happened in Washington State, where a choir got together and sang and projected droplets into the air. And there were over 40 cases and several deaths that came out of that choir. I did put in the specification that in these live streamed events that there should not be singing because it was too potentially dangerous, or wind instruments or harmonicas. So there has been a lot of concern about this singing. And so I am considering on Friday releasing singing from being restricted in live streamed events, but I am still going to keep in wind instruments and harmonicas because I don't think we can possibly know how you would project droplets through, let's say, a trumpet and how dangerous that might be, since we know there's asymptomatic COVID disease. So in this new revision of the sheltering in place, it will say that, you know, those who do the live streaming events need to take into consideration that singing will project droplets quite a far distance, and they will need to take that into consideration and mitigate against that. The other issue that I'm wanting to look at with County Council, because we need to make sure that it's not going beyond what the governor's order allows, is for local businesses to be able to deliver, using their own employees, their products of their business to those who order those items locally. So having a delivery service for non-essential businesses to be able to sell their current inventory. So these are the 3 areas: the singing, the 10-mile radius from home, and a delivery service that I'm thinking of revising our sheltering in place orders on Friday. I'm bringing this up today because I'm wanting to share what I'm thinking so that there can be possibility for input to me, which comes through our call center. It comes to County Counsel, and I carefully review every single item that comes before me. The other issue is that there are things that are in the sheltering in place order that I get questions about that are allowed, that certain individuals and groups think are not allowed. And so I am asking the Board of Supervisors to help me with sharing of information to the community so that they are able to do those things which are allowed without fear of enforcement issues. So I am asking the Board of Supervisors to help me to get that information out. We do it through FAQs on the county website. We address when there are questions. We post FAQs that I work on with County Counsel. The other thing is that in terms of limited reopening, which the health officers across the state believe is going to happen sometime in early May, I am asking the Board of Supervisors to set up a committee that would work with West to help message to the business community that if they can come up with plans that will show how when we have limited reopening, their businesses, and I'm going to include the churches and the schools in this, that their organizations can function in a way that allows for social distancing, that decreases the risk of transmission of disease, and shows benefit to our community, that I want to support those endeavors to include those businesses and organizations in the limited reopening. So if I may give an example with, singing in a live stream event, if there was a plan, for example, to say that those who are singing will be behind a plexiglass shield, which will be then, desanitized afterwards, that would be an example of how you might have a mitigation that would be that would allow there to be safety. Also, something like if windows were left open and the singers were standing where there is ventilation, we know that ventilation is helpful. So I am going to be asking the Board of Supervisors and West to help me come up with industry-specific and organization-specific ways that we can ensure that as we do limited reopening, we do not spread this disease in our county and create situations for outbreaks that would be devastating for us. I've been asked what would be my goal in terms of testing. My goal would be that we can test all symptomatic people freely with prompt results, and that we would be able to do surveillance so that our workers and those people who need to be in front of the public can be surveilled and tested, and so that we know they're free of the disease, and if they're not, that they can go home and recover in isolation as much as they are stable to be at home. Also that we would do surveillance in our nursing homes, in our jails, in our congregate settings, so that we make sure we don't have outbreaks. Let me just mention at this time that in the Bay Area, there are 34 nursing homes that have outbreaks of COVID-19. When I listed all of the counties earlier, every single one of the counties has had an outbreak in at least one nursing home of COVID-19, except for Solano, Napa, Mendocino, and Lake. So this is an area of great danger, and it's actually horrifying what's happening in our nursing homes. And that is why I'm very grateful that we have made the progress we have in our county to getting alternate care sites set up, and have done some very strong work around that in our EOC with Whitmore Lane. And the 1,224 skilled nursing facilities in California, 261 have reported one or more cases in a healthcare worker or resident of COVID-19. This is an area of great concern. Regarding testing, I will speak for all the health officers across California. We're very unhappy. We are outraged at the shortage of testing capacity. We do everything we can, and I do myself, to advocate for increased testing capacity. This goes all the way up to the California Department of Public Health, where Dr. Charity Dean has been put in charge of the testing task force. The testing still remains to be in great shortage, and this is based on the sample collection swabs are in short supply, the viral transport media is in short supply, and the ability to do the tests. The testing reagents are in short supply. But I want to give some data about our Mendocino County testing. We have done 492 tests in Mendocino County. Those are 197 of those have been with a public health department, and 295 have been through commercial lab testing. Of the 197 that were done by the public health department, 135 of those were surveillance, where we're going into facilities that have high risk of transmission, or if we are concerned, let's just say we want to look at a population to see if the virus might be present in the population. These are for people that are not sick. They have no symptoms. So we've done 135 surveillance tests. All of those have been negative. And we're planning to do more. We have 100 more test collection kits. And that's it at this time. And those sample collection kits will be used to do surveillance in the coming weeks, and those plans are underway. And Dr. Flaherty, my deputy, has been leading on that. So of the 197 public health lab tests that have been done, 135 were for surveillance. The other 62 were tests that the public health department facilitated for our partners. So I want to make this very clear. The public health department does not do testing for people that are sick with symptoms consistent with COVID-19. We facilitate the testing for our partners, meaning if we have an individual who we're worried about an exposure, let's say at the jail, NAFCare at the jail will collect the sample, and then public health will courier that sample to our lab, our public health lab in Sonoma County in Santa Rosa. We facilitate the rapid turnaround of that testing. And we are very happy to do that. And it's an important role. And we've done that for 62 tests. We've facilitated rapid turnaround for individuals who were very concerned, and our healthcare partners wanted to get that result quickly. That facilitation happens for the clinics, for the hospital, for our jail, for our public safety, for our first responders, on request of public health to help. The 295 tests that were done through commercial labs were done by the clinics and by our healthcare partners. And of all these tests, 492, we only had 5 positives. I do want to share as well that there is an effort that started on the East Coast that has now come to the West Coast to get a sense of spread of the disease in a county. And that is where you test a sewage treatment plant of the sewage before it's processed. Once it's processed, it would kill the virus. But if you look in the sewage treatment plant and test the sewage before it's processed, that's going to give a sense of whether the virus is present in the sewage. And we know that the virus is shed in feces. So this was done in California by Lake County. They started this effort in the end of March, and they did testing at the end of March, the beginning of April, and then again April 8th. They did the testing on all 4 sewage treatment plants in Lake County, and the first round of testing at the end of March was all negative. The second testing in the beginning of April was all negative, and on April 8th, all 4 treatment plants turned up positive results. This does not mean that water is infected with COVID-19 or anything like this, because the virus would be killed once it goes through treatment. But what it does indicate is that there's likely community spread in Lake County because it's showing up in the sewage. And so I have spoken with Dr. Gary Pace about this, and I would like to see us do this testing in our county. I will tell you that as a health officer, I don't really know anything about sewage treatment plants. I will admit this to you, but I know we do have experts in our county who do, and I will suggest that we look into this testing so that we can do weekly testing in our sewage treatment plants to see if we have any evidence of community spread. The other thing I want to mention is that there's 2 orders that I've shared with the Board of Supervisors, and I'm requesting feedback on these orders from the community and the board, and that's why I shared these orders that I'm expecting to come out on Friday. The first one is a facial covering order. I already have a guidance in place for facial coverings. This will become an order, and I'm expecting this to happen on Friday. This allows us to have another layer of protection in our county against the community spread of COVID-19. I am releasing this for discussion essentially early because I want, first of all, the community to get ready to know that there would be an order for facial coverings that is similar to the guidance. So you can look at the guidance on our county website to see what that shows. And I also submitted the draft order to the Board of Supervisors, so it's available to the public. Simply that when people go out into public and are coming into proximity to other people, they should cover their nose and mouth with a cloth that they can be homemade or it can be purchased to prevent others from potentially being infected when the person wearing the mask is asymptomatic. So again, that is up for public view, and I do anticipate that coming into place on Friday. The other order that I'm anticipating coming into place on Friday is around medical grade masks being worn in medical facilities. And it also addresses first responders and public safety having masks when they are around in proximity to the public. So again, these have been shared with Board of Supervisors, and I will be receiving feedback and will be making the final orders on Friday. That is my report for today. Thank you very much.
All right, thank you. That was very informative. And you're scheduled to talk at the end of this, but you just covered the shelter in place order. So I'm sure there will be some questions later for you, Dr. Duhan. We'll go to Deputy CEO Darcy Antle for the fiscal update.
Good morning, Chair Hashak and members of the board. I have a COVID preliminary financial report and presentation for you today. I would like to say we are only 7 weeks into this event. Invoices have not been received from vendors and suppliers. All expenses are being tracked manually by the EOC finance team. Items charged to purchasing cards, vendors, or supplier accounts are not all captured at this time. The month of March was just closed last week by the auditor controller. This presentation is a snapshot in time. Again, the EOC finance team has worked hard to pull the following information together, and we will review a few slides with you now. Okay, so here on our first slide, you can see, again, this is a preliminary report. Total expenses by department line, $1 million in total expenses that have been captured to date. And you'll see the salary and benefit number for the COT, compensatory time off, and the overtime at $526,000. You see various other expenses there that we've been tracking for you through our department. The total contract payment at the bottom in the circle, you can see public health has paid out close to $77,000, and the DR budget unit has paid out close to $20,000 in contracts. The other slide you will see is an all, it says public health, no, stay down, there you go. It says public health, but this is all COVID expenditures and contracts that we're tracking at this time. Again, contracts. So this includes doctors, facilities, services, such as Mendocino Coast Hospitality as we extended their open hours. Nurses that we are hiring to work at the ACS, the alternate care site. N95 masks that we have purchased, and our sign language interpreters. Now we can go to the next slide, which this top slide is Zoom year to date. This demonstrates the new reality that we are working in virtually and how many hours we are working to communicate with each other within and outside of the county. Following over, you'll see the COVID hours, the 4,857 hours. That relates to 381 employees who have been working on this disaster. This number reflected back in the payment of over 500,000 on the previous slide. We also know in the finance team that we are going to take a hit in departmental revenue. So we took a look at one of our largest department that drives departmental revenue, and that's planning and building services. In this slide, you can see that we have a 40,000 decrease from this year to last fiscal year. We believe this is due to the shelter-in-place order and folks not picking up permits that have been processed. I myself am one of those. This certainly is not reflective on the hard work or less volume that the Planning and Services Department has been doing on permits. Then we would shift over to the public health vouchers issued. Again, this was a snapshot in time midweek last week, where we had shelter 131 rooms. And we say rooms because we're never sure how many are in the room. This is Project Room Key, which you've had a report on prior. So we're tracking those expenditures as well. And then on our final slide, you will see some of the work we have been doing with FEMA. As Carmel mentioned, receiving our award letter for $753,000. This is based on one project that was submitted to FEMA with a 90-day projection. I submitted that project on April 3rd, and we received our letter on April 16th. So we were working very closely with FEMA. On Friday, I submitted 2 more projects, a 90-day estimated cost for the alternative care facility. You see those costs there in the bottom slide, with the estimated total cost of $672,000. And then the larger slide, the FEMA cost inventory, just shows a breakdown of our costs and our estimated reimbursement for the 3 large projects. We would also like to see the state of California enact the California Disaster Assistance Act funding, which would help us further. Once FEMA determines the 75% eligibility, the state can then come in and offer 75% of the remaining 25%, ultimately leaving the counties and local jurisdictions with close to 7% of eligible costs. So that helps us greatly if they will move towards that. The finance team with grant writers, LACO and Associates, have been working very hard with HHSA, EDA, and the USDA and other opportunities to continue to look at grant funding to help throughout this extended time fighting the virus. One thing not reflected in these slides is the decrease in revenue projection. After a meeting with our tax consultant HDL last week, the auditor controller projected a decrease in revenue this fiscal year, 1920, of a total $4.5 million. Discretionary revenue, the 4.5 breaks down into discretionary revenue at 2.2 million, teeter plan hit of 2 million, and an additional 400,000 decrease in our Prop 172 revenues that are an impact to our public safety departments. that concludes my report at this time.
All right, thank you, Deputy CEO Antle. I'm sure we'll have some questions for you later. But right now we're going to go on to the Cultural Services Agency Director, Karen Horner. Thank you, Ms. Horner, for being here. And we asked for this presentation on the county parks and what our role could be, how we could look at reopening or limited reopening. And so, Ms. Horner.
Morning, Supervisor Haschak and Board of Supervisors, CEO Angelo. I wanted to let you know about something that we've been working on in reference to the April 10th shelter-in-place order that Dr. Duhan had put out, allowing people to access, walking to get exercise. So I've been working with CEO Angelo and her executive team, and we would like to phase in some opening of our parks, and we're looking at allowing the residents that live nearby Faulkner Park and Bower Park in Wallala, and Faulkner Park is in Boonville, to allow local residents to access that for exercise, to go out and be able to walk and jog. These two parks were selected based on the remoteness and also because of the access for the residents that live there, the limited areas that they have to access. We thought that this would be the two best parks to start the phase in with. And that would be beneficial to those communities who, especially in the Boonville area, they don't have a lot of other areas that they can access for walking and exercise, as of course a lot of the state parks are closed right now.
All right, is that it?
Yes, we thought we'd start. I just want to let you know that we'd start with these two, see how it goes, kind of doing a soft opening. We've talked with our other agencies and partners and other parks. And we also, the city of Fort Bragg had done a soft opening for their coastal trail. So we're kind of looking at to do the same thing with those two parks to make sure that we can kind of limit who's accessing the park and making sure that it strictly is for residents. Of course, all of our other parks will still remain closed and all the other activities will still remain closed, parking and bathrooms. This will only be for local residents to walk or jog and hike in those two parks.
Okay, very good. Thank you. And then we're going to turn to Dr. Jim Flaherty. Dr. Flaherty, are you on the line? Dr. Flaherty?
Mr. Chair, Janelle Rao, Deputy CEO, I don't believe that Dr. Flaherty has been able to log in. We will outreach to him and perhaps he can join in just a few minutes.
Okay, very good. And then I have on the list here, Dr. Duhan. Is there anything else you'd like to add before we open it up to questions from the supervisors? Dr. Duhan?
Can you hear me?
Yes.
Okay. There is nothing I would like to add at this time. Thank you.
All right. So we're going to take some questions from the board. So what I'll do is I'll go through the list and see if we have any questions for any of the presenters at this point. And then we will take public comment. At 10:30, Senator Mike McGuire is going to call in to talk about the inmate situation and some other issues that he has been dealing with the state. So we will cut to him at 10:30. So at this point, I'm going to go to Supervisor Brown.
I don't have any questions at this time.
Okay, thank you. Supervisor McCowan.
Thank you, Mr. Chair. One thing that I would point out, the allowance to drive 10 miles to go to a recreation site is actually more restrictive for possibly quite a few residents. For instance, if you live 12 miles up Mountain View Road from Highway 1, there's no place within 10 miles that you can drive where you can safely recreate if you couldn't do so at home. So, I really think it's a positive thing that we're attempting to loosen the orders, but a little fuller consideration of exactly what the impacts are is probably in order. And we might also ask, or I might ask, what is the science that says a single person or two members of a household riding in a car for 25 miles to go to a trail and then maintaining social distancing is any more risky than driving 10 miles and going for a hike, maintaining social distancing? And then I do have one more question after that.
Do you want me to respond?
Yes.
So the concern is not the people in the car. The concern is that with sheltering in place, we are meant to only leave our homes for essential activities. And we're supposed to minimize the amount that we leave our house because there could be unintended consequences. So that person who goes on a 25-mile drive with their household and their car breaks down, now they're on the side of the road. Now they have to get essential workers to come rescue them. Now maybe they get in a car accident. They have to use one of our precious hospital beds. So the idea with sheltering in place is to leave the house to the minimum extent required. And therefore, it is very limiting and it is very frustrating, but that is the purpose. And look, we can see it's been very, very impactful. We've been able to flatten the curve, slow the spread, because people have been staying home. As we start looking at limited reopening, it's going to be just that, limited. If we just open the door and say, just think about your own family, get in a car, you're fine, don't worry about it. We're not thinking about the impact on those that they might encounter along the way. So, and might inadvertently be infected by someone they encounter along the way. So I'm definitely open to feedback. That's why I've released these ideas that I am working on publicly. I think that 15 miles instead of 10 would be fine. But if we start getting into, you can drive from Ukiah to the coast, to recreate on the parks there, I think that would be very, very concerning because we need to stay in our areas, in our home areas to limit the spread. Thank you.
Thank you. And it's, all your points are understood. And yet, given the nature of the county, even being able to drive 15 miles still might not get some people to a area where they can safely recreate. But I have some suggested wording that I might send to you offline. I do believe that the ultimate protection, while shelter in place is an extreme form of social distancing, if people aren't practicing proper social distancing when they go out in public, or a friend or family member goes out in public for them to get food or pick up a prescription, then that household is still at risk. So I welcome your intention to issue a masking order that would, as I understand it, require everyone to wear a mask if they're going into any enclosed space, if they're out and about, if they're in proximity to other persons, they should be wearing a facial covering of one kind or another. So I totally support that. I actually think more stringent social distancing, along with the testing, is the key to being able to reopen various businesses, which I think you're looking forward to doing that potentially not on April 24th, but in your following order, which will come out approximately May 10th. And so again, reliance on the social distancing, keeping the 6 feet, masking or face covering, hand washing, those are really the things I think that ultimately will justify relaxing the orders further. So making the face covering mandatory now is good preparation for when we hope to see the beginning of reopening. Thank you. And I might have one more question later, but I'll defer to others for now.
Okay.
Thank you.
Supervisor.
Yes, thank you. Yeah, thank you. Thank you. I agree with everything that Supervisor McCowan said. Thank you for those comments. I would add there's one other protection that's very clearly stated in the sheltering in place order, is that people who are sick must stay home. And that is also going to be highlighted in these new orders on Friday around wearing masks and facial coverings, is that if you're sick, you should stay home. Unless, of course, you need to seek medical attention, in which case you should call ahead and get that medical attention. So thank you very much.
And Supervisor Jurdy.
Yeah, thank you. And thank you, Dr. Dew, for asking us to ask you for clarifying questions so that we can help get the correct information out to the public. And one of those points, there's been some confusion on the coast about whether or not people can go fishing for food. And you've clarified to me personally, but like maybe you could just clarify it on our televised meeting here, what the rules actually say so that we can get the correct information out.
Thank you for that important question, because it is definitely stated clearly in the sheltering in place order that is in action now that it is allowed to fish for food. And there is, though, the restriction, and I do apologize, I don't have the language right in front of me. I could look for it. I mean, I have it at my fingertips, but it's not right in front of me at this moment. There is the restriction that the waterway needs to be accessed by a place that is open, like a launch ramp that is open, and that may be under local jurisdiction. So the fishing for food, there is no restriction on that. And perhaps County Counsel, you might be able to comment as well, because we did discuss this in our meeting on Saturday evening.
If I may, Mr. Chair.
Yes.
Thank you. So first, I'd just like to comment for the benefit of the public and the supervisors. This actually is something that's addressed both in the order and in the FAQs available on the website. So if anyone's uncertain, you can certainly refer back to that. The rules as they are do allow hunting and fishing for the purposes of gathering food. There's still restrictions on gatherings that shouldn't involve groups coming from multiple households, such as using a guided service or a charter fishing service. I believe what Dr. Doohan was referring to earlier was that in addition to the fact that people need to be complying with the social distancing requirements if they engage in these activities, the places where they do that may need to be places that are open. And as it is currently in the latest version of the order, those locations have to choose to be open and to take certain steps to be open before they could be used for these sorts of recreational activities.
If I could just follow up, and I want to thank Dr. Doohan for inviting public comment from businesses about how they think they can operate in a safe manner. And what looks like the first of these changes would be the allowance of businesses to sell. And maybe you could clarify this. Would this be for existing inventory of products? And you said that the business could either deliver it by postage or they could deliver it directly to the customer. Could you just clarify how that would work?
Yes, I'm working with County Counsel on this to make sure that it does not violate the governor's orders, which again, we can be more restrictive, but not less. But yes, the intention is there is a clause in their sheltering in place order that says that non-essential businesses may sell their existing inventory as long as it's done through delivery. And I wanted to clarify that delivery could be by an employee of that business to deliver it to the purchaser within the county. But again, it's concerning because we don't want unnecessary travel because that can put our county more at risk. So County Counsel and I have to work on this, but the intention could be, for example, a store in Ukiah that has existing inventory being able to locally have it delivered without having to use the mail service.
Thank you. And I just wanted to point out for the benefit of the public, on our consent calendar was an $85,000 contract with West Business Center, who is doing great work on behalf of the county. And will be holding a series of, I believe, at least 4 virtual meetings with businesses throughout the county from different business sectors to find out, again, how they propose to operate in a safe manner and then provide that information to you, Dr. Duan. And there is a meeting today at 1 o'clock organized by the Mendocino Coast Chamber that I'll be participating in, assuming we end by 1. And that's specifically with lodging operators. It's not clear at all at this point when different business sectors would be opening. And you've indicated that there may well be multiple incremental reopening of businesses by business sector. And so is there anything else you could just share with us in terms of maybe not a timeline, but just sort of the prospects of there being multiple incremental reopenings, assuming we don't have a surge of cases?
Yes, well, thank you for that question. As I said, we can only be more restrictive, not less than the governor. And the best guess, educated guess that I have is that the governor is going to be doing revisions for limited reopening in the beginning of May, as well as the Bay Area health officers, which the governor seems to closely follow what they do. As far as I can tell, that seems to be part of how the governor's plan works, which makes sense because the Bay Area health officers have really been leaders, and what their actions have done have been very effective in flattening the curve and slowing the spread. So I'm expecting that it'll be in early May that the governor allows some limited reopening, which then would allow Mendocino County to have limited reopening. So that's why I'm very appreciative of these conversations happening now and starting now, shall I say, with the business community and our organizations such as churches and schools, so that we can be ready for when the governor does limited reopening and follow. I do expect that it will be in phases. And I have shared with the Board of Supervisors some of the foundational writings, such as Gottlieb's roadmap to limited reopening, which is being read widely by government officials and health officers. And the phases are that you first do let's just say, okay, I don't know, but let's just say that it's probably likely that bars will not open in the first phase. I haven't heard any of the health officers or the governor talking about bars being reopened in the first phase. So, but what we might see in the first phase would be, sole proprietorships or, small businesses where the business owner can really make sure that social distancing is done and that there's a low risk of transmission for local people. Then perhaps in the third wave of reopening, we would get to bars. So, it's just really a matter of looking back at, we don't think that more than 5% of the population in California has probably been infected. So every time we do a limited reopening, we're introducing the possibility of more people getting infected. And we have to see how that impacts our healthcare system, which when I first started talking to all of you in the beginning, we talked a lot about protecting our healthcare workers and our healthcare system, because if we collapse those, then we can't get healthcare, and then this is dire. So we will see many of the metrics look at the impact on the healthcare system. Are we having increased hospitalizations? Are our ICUs at capacity? Are we getting healthcare workers who are being infected? If we started seeing a surge in that, we might have to pull back on what we've allowed. That's why it's in phases. We have to see the impact on our systems to see if we are safe to have open to the extent that we did. Did I answer your question?
Yes, you did. Thank you very much.
Thank you.
All right. And Supervisor Williams.
Yeah, I have one comment and 2 questions. Comment echoing Supervisor McCowan's concerns about the 10 miles. I grew up in Comshe, and there isn't any public access within 10 miles. And so I'd hate to have law enforcement cite somebody who, say is picking up a prescription in town and stops at the only public access between the pharmacy and home. And so that 10-mile radius might work in Ukiah. In the rural parts, it's probably not adequate. The questions. I know 4th of July planning is underway on the South Coast. I imagine that could be the sort of type of activity that we're not ready for in July. And it'll do less harm if we can give some forecasting. Do we need to wait until May? Or Dr. Duhan, would you anticipate the 4th of July events being premature?
Thank you, Supervisor. If you could make a suggestion to me, it doesn't have to be now, about what a reasonable mile limitation is, I would be very open to hearing that. Now, regarding the 4th of July, remember where we started with all of this was mass gatherings being canceled and that coming down from the governor. So I think the question is going to be what size of gatherings will be allowed. And I don't know. But, when we started out, it was no more than 10. Then it was, less. We started at less than 250, then less than 50, then less than 10. So it really depends on what the governor decides. At this time, all gatherings have been banned. So we wouldn't be able to have anything like the Mendocino 4th of July celebration because that involves hundreds of people. So I just don't think we know. And I really have no idea. I haven't gotten any indication of those gatherings and when they will be allowed again.
And then last, I imagine there's certain types of businesses. I think you mentioned bars that likely are not in the first phase. Some businesses will be in the last phase. In broad terms, can you touch on what sort of businesses would be in the last phase and how far out might that be? And I know we lack visibility into models, the state plan, how this will unfold, but your guess is, you're the expert, your guess is better than mine. And I know we have businesses that will make decisions that may allow their sustainability based on planning. And if they feel they can open in a month or 6 weeks from now, and we know they can't, it's better to be transparent and communicate that so they can get the necessary loans or make other arrangements to not go under. So which businesses do you think would be at the last phase, and how far out might that be?
Yeah, well, thank you, Supervisor Williams. I could share your concern about this, and one of the questions I've been asking when I'm in the meetings of the Bay Area health officers, and when I've been in conversation with anyone who might be able to understand what the governor is planning, I've asked the question, what might we expect not to be allowed to reopen in 6 months? I think that's very, very important information to have. And I haven't been able to get an answer on that. But what I have been able to get is the metric of how we measure what we might be able to allow. So, and that metric is the ability to social distance, the ability to limit transmission, and the ability to show benefit to the community. So community benefit with social distancing and limited transmission. And I would say that any business that could show that they could do all three of those things would be in a good position to be allowed to reopen. And the concern about bars, of course, is that when people are, celebrating and enjoying, adult refreshments, as we call them, or, alcohol, it's hard to limit, to say that people would be maintaining a social distance. It's just hard to imagine how you would do that in a bar. So that's the reason why I say it's unlikely that bars will open in the first phase. But if we had a bar that said, well, we'll keep everybody 6 feet apart and we'll, make sure transmission is limited, then that might be something that would be considered. It's hard to imagine how that would work. The limited transmission piece, also comes down to people coming into our county from the outside. So I do know that much of the conversation is about how do we make sure that people stay within their own community. which is again where we get into this distance driving from home challenge, is that we want people in as much as possible to stay in their own communities. So when, for example, the earliest limited reopening, we want children to be able to go to summer camp. I think that's something that across the board we're wanting to see with other health officers, but we're talking about those children going to summer camp in their own neighborhood or in their own town, and staying in small groups through the summer of 12 or less with one counselor. So again, it's looking at limiting transmission. And as much as we can think about how we might limit people coming in and out of the county, that would be helpful to the discussions. And if I just take a leap here to talk about tourism, what if there was a way for, and I don't know if this would be allowed, I'm just going to say this, as a what if there was a way to allow someone to come to have, be in a vacation home for 60 days? Well, the first 14, they could be quarantined. And then after that, they've been quarantined and they could then have that vacation experience. Might that be possible? I think it might be, because again, you're dealing with that transmission issue from people bringing the disease from out of the county. But I think that the issue around tourism is going to be one of the most challenging, and that I'm part of a group of the Northern California Rural Bay Area Health Officers. We call ourselves Rancho, Rural Association of Northern California Health Officers, and we meet regularly. And this is one of the biggest issues we have, because in our counties in general, we haven't seen community spread. We have low numbers, and tourism is an essential part of our community's economy. So, it is a major issue. Have I answered your question?
Yes. Based on what we know today, is it foreseeable that some businesses could be shut down for 6 months or more? Could the last phase be that far out?
I think that what we are anticipating are several waves of the infection coming into our communities. And I just don't think we know yet. I'm sorry, I don't know the answer, but what I would say is I think 3 months is something that I've heard. That we're hopeful that in 3 months we would be able to, for example, see restaurants opening with some restrictions, like having to have tables so far apart, and certain hygiene requirements where people don't touch shared, salt shakers and so on. That's the risk of transmission being limited. I haven't.
Thank you, Supervisor Williams. Let's see. Before Senator McGuire comes on, I have a couple comments and questions for you, Dr. Duhan. One is the ad hoc or the committee that you want formed with the West Company. I think that's it's a very good idea, and I think the chair will be coming up with a recommendation for an ad hoc committee to deal with that. I think that we need to get our businesses involved in the decision making and see what they can come up with. I think your approach is very reasonable about having them come up with what works for them as businesses. So I look forward to having that happen in each supervisorial district. With the testing, the testing is a national problem, and I wish that these people who want to reopen would put pressure on the national government to get testing for everyone, because it seems like that's what's really holding us up or is a potential barrier in coming up with a limited reopening, is our lack of testing. And then the singing and musical instruments in church services, which has been an issue. It seems like with the live streaming, that since people are already, limited to only 4 people in a church to do a live stream, that would be enough of a mitigation factor to deal with the singing or the musical instruments. If you're 30 feet from another person, that should do it. And then I've also heard about the fishing and the fear of out-of-towners coming in, as well as with all of these activities, the 4th of July celebrations, people coming from all over the place, that could be a real factor. And so how do you address that? And how do we address it as a community? Because people in the summer will want to come up here. So I look forward to having those conversations. And if anyone has ideas or comments about that, they can certainly send them to me and I can pass them on to you, Dr. Duhan. So thank you for your approach to these.
Supervisor Haschak?
Let's see. Yeah, Supervisor Brown and then Supervisor McCowan, but we're going to have to cut off at 10:30 for Senator McGuire.
Okay, and I don't know how much time we have, and you can cut me off if you need to, but through the questions and discussion of all of you, Supervisor Jurdy, is Noyo Harbor launch ramp available and open? I know that there's a number of community members that have boats at that launch site, and from some of the emails I've gotten, that that location would be easy to have distancing between people, and then once out on the open water with your family, that it should be okay. But is the Noyo Harbor launch ramp open for fishing?
So Supervisor Brown, my understanding is that the launch ramp has been closed, and I think we got clarification here from staff that it's up to the Harbor District to allow limited use of that launch ramp. And perhaps what they could do, since they know pretty much everybody who comes in every year, is just an idea, they could perhaps limit it to people who are from within Mendocino County to use the launch ramp.
Okay, thank you very much. And then Supervisor McCowan and also Supervisor Williams talked about distance that an individual would go in order to recreate. I have received, and I think all of you have, several emails and other comments from communities, and they have asked not to allow recreators, even if they're Mendocino County residents, into their neighborhoods. They didn't think that that is something that should happen to protect them. And then I do have a comment about business, and we all know our businesses are hurting, with the possible exception of those deemed essential that are still now open. But I do feel we do need to allow many to open, including those, and I don't know what you'll think, Dr. Duhan, but hair salons and barbershops. And I know you have stated previously you're worried about the distancing, but I do believe that the owners of these businesses can provide their clients with proper protocols as masking and hand gloves, and that the actual business person can provide those to their clients as well as themselves if they're being having their hair done. Stations could be distanced for the proper space as any restaurant, and I heard you talking about restaurants, and disinfectant can be done per client. Not sure about the airborne droplets. Can sprays be used after clients? But basically, for someone like myself, and I'm sure there are others my age, we will be really very cautious about our activities until a vaccine is found. And I feel that both individuals and businesses need to be cautious about a reopening. This may lead to legal action, because I have heard on the news that this has happened. And I'm also hearing the many messages being made on social media that we're all in this together. But business may be held accountable, something that was never done previously in pandemics. And it is unfortunate because each of us must be accountable for our own care and what risks we take. But I do look forward to the conversation about businesses being able to reopen.
Yes, Supervisor Brown, I just briefly say that I think that is something that I would be waiting for the governor to speak on and make a decision on, and that will be I'm sure something that the governor would be addressing, I would think. Health, hair salons and these types of facilities.
Okay, thank you, Dr. Duhan. I'm going to see if Senator McGuire is on the line. Is Senator McGuire on the line?
Chair Haschak, Janelle Rao, Deputy CEO, he is not logged in yet.
Okay, then we'll try to squeeze in a comment from Supervisor McCowan.
Thank you, Mr. Chair. I do have several questions or comments. Please cut me off the instant Senator McGuire is available and we can come back. One thing, it's been suggested before, given the importance of social distancing, that when the new order comes out, it could have a text box on page 1 highlighting the key social distancing factors. I believe the public health officers previously stated she supports that idea. In fact, I think may have suggested the text box. So given some time before Friday, I'm hoping that can be incorporated. I do support business groups, trade groups, whatever might be out there, coming forward with suggestions on how they could safely reopen. However, there's many small businesses that don't particularly have an organization specific to their industry. So perhaps we could reach out to the Chamber of Commerce's, of which I believe there's at least 5 in Mendocino County, geographically dispersed, and they could solicit from their members. For instance, with regard to the hairdressing and barbers, Supervisor Brown mentioned common sense things, totally in line with social distancing. So the operator is wearing a pair of gloves. The operator and the customer, where feasible, could be wearing a mask. Hand sanitizer available, proper spacing, sanitation of equipment, because honestly, I would like to get a haircut sooner than 3 months from now. And what we will see happen, and it's already happening, people will do what they have to do to try and earn money to support themselves and their families. So you'll see people cutting hair in probably less than ideal conditions. Some people will be very conscientious. Others will probably not follow the social distancing. So again, greater reliance on social distancing, hopefully highlighting that on page 1 of the order. And I guess these are just comments. You can take them for what they're worth. Another point, we're in a bit of a catch-22 in that the governor said, I really want to hear from the health officers on how we should go about reopening. And the health officers are saying, well, we have to wait and hear from the governor. I would advocate that the public health officers are in probably a better position to determine what are the ways in which we can safely reopen based on all the input you're getting as well as your own discussions. I would hope you would come up with suggestions that you can present to the governor that balance the absolute protection of public health.
Okay, Supervisor McCowan? Yeah, I'm going to cut you off right there. Senator McGuire is on the line, and so we're going to welcome Senator McGuire. I called Senator McGuire Friday after I heard about the inmate that had been released from Chino State Prison and who had ended up in Mendocino County. And Senator McGuire instantly took my call and had already made some calls at the state level trying to figure out what the issue was with this. So I really appreciate Senator McGuire's work on this. And he said that he was more than willing to call us and tell us what more he found out during the weekend. And so I appreciate Senator McGuire being on the line, and welcome, Senator.
Good morning, Mr. Chair. Good morning to the board. I hope all are doing well, staying safe and healthy. I want to say good morning to the county administrator as well. Mr. Chair, through your discretion, would it be all right to give a very brief update? I'll then pause, of course, and then open it up to you and to the board. Would that be all right, Mr. Chair?
Oh, that'd be great. Thank you.
Again, so very grateful to be with you. And to all the board members, thank you so much for allowing me to be able to attend your meeting. Bottom line is this: I think that Mendocino County has done a remarkable job in facing down this pandemic. The county and residents have sacrificed so much to be able to beat this thing back, and it is working. And in the case in front of us now, with the prisoner release, clearly mistakes were made that could put the public's health at risk. And I want to applaud the Mendocino County Sheriff, as well as the public health officer, your board, for moving quickly to be able to nail this down. Let's be honest, Mr. Chair, I have been in communication with Sheriff Kendall, which I'm grateful for his efforts and his guidance and counsel. I'm grateful to Secretary Diaz, who oversees the California Department of Corrections and Rehabilitation, oversees the prison system. I appreciate both gentlemen working with us here over the weekend. And here's the bottom line. The county not being notified in a timely manner about a release in an individual who is positive for the virus, it's not acceptable. And not having a protocol in place for transfers of individuals coming from prisons with the virus is simply not okay. We have 2 prisons within the state system that would be considered hotspots. One is Lancaster, and the second is Chino. I will be clear, the state prison system has been very focused on containment within those 2 institutions, but where we have run into challenges is on the early release and not having prisoners follow through with their 14-day quarantine. I've spoken with Secretary Diaz a few times over the weekend, and again, as we just talked about, Sheriff Kendall, and we will be on a call today. Secretary Diaz and Sheriff Kendall and I focus on making sure processes are put into place to avoid this happening in the future. I will also say that state prisons in the California Department of Public Health, they have been working over the last many weeks on a parallel effort to firm up processes focused on stopping the spread, especially from those 2 prisons that I just mentioned that have the highest number of viruses out of all the institutions in the state. And I will say the Secretary Diaz, is more than committed to working this through. Mr. Chair, I'll wrap up momentarily and then open it up for questions. Obviously, I was also on a call this morning with the Secretary of Health and Human Services from the state of California, and the Secretary of Health and Human Services in his department also very involved and know that we need to be able to set up protocols. Does this help Mendocino County after this transfer? It does not. But again, thanks to the hard work of your public health department, the sheriff, and protocols that this board has put into place, do believe that it has been contained, and the individual at hand has been cooperative working with local officials. And I also think that we need to be able to increase communication between CDCR, the California Department of Corrections and Rehabilitation, and state sheriffs in general. And that is going to be one of our goals today with this call. Mr. Chair, we're also going to involve the sheriff from Lake County in this discussion here later this afternoon. I'll finally say this. Everyone in Mendocino County has sacrificed so damn much to make sure that this pandemic is shut down as quickly as possible. Our bottom line is the health and safety of the people of this amazing county are put at the top of the priority list. We're going to continue to work together to keep it that way. We have been in direct communication with state prisons, with public health, since we were made aware of this transfer. And I will also assure you that state prisons and state public health want to continue working with the county on this issue here in the days and weeks to come. I'll stop talking now and then turn it over to you and your board. And again, Mr. Chair, thank you for allowing me to be with you.
Well, thank you, Senator. I'm certainly glad to hear that, you know, all the work that you've been doing on it. It certainly is, like you're aware, very concerning to us in Mendocino County about this release, because we have been doing so much to keep our community safe. So appreciate your work on it. And one of the issues we're dealing with right now is the limited reopening and how that's going to look. And from what I hear from the national level down to the local level is that it's all dependent upon testing and testing. And so what can we do or expect from the state government about testing?
So I'll give you my editorial first, and then I will talk about where the state is heading. I don't think, and I'm not at all trying to be political, Mr. Chair, but I'm going to be very candid. I do not believe that we are going to see a strategic, streamlined approach from the federal government and this current administration. I just don't think it's going to happen. This state is very focused internally on developing a comprehensive strategy that will roll out aggressive testing in urban and rural parts of the state, in every corner of California. I will share with you, we're working on it even as we speak. And this is number one priority for California Department of Public Health, and the number one priority for the governor, the number one priority for the legislature. So I know that folks want a date on when we're going to be able to ramp up testing. So that's what we're working on. I'm not at all trying to be coy, but I think it's going to be, just being very honest, we're going to need probably another couple of weeks to be able to line up the resources and the personnel to be able to get an aggressive testing matrix deployed in rural counties and urban. So we're working on it even as we speak. It will be a state-sponsored program, and it will also be organized by the state. More to come on this. I'd be happy to come back next week to be able to talk more about it, but I assure you it's being worked even as we speak.
All right, thank you for that. And just one last question is about skilled nursing facilities, and we're certainly concerned about the people in those facilities. We're hearing about outbreaks, you know, all over, starting in Seattle and in the Northeast and now in the Bay Area. So what is the state doing to coordinate efforts to deal with skilled nursing facilities?
So skilled nursing facilities become testing. So let me back up. We've heard the governor say that he wants by the end of this month to be able to get 25,000 tests per day launched. Top priority at this point is going to continue to be, between now and the end of the month, the most vulnerable populations, including those who are residents of skilled nursing facilities, number one. Number two, skilled nursing facility employees. Number three, obviously frontline workers like law enforcement, nurses, doctors, LVNs, et cetera. So due to the lack of testing equipment, due to the lack of testing personnel, we're still, again, I always want to be honest. I think the best that we're going to get to by the end of the week, by the end of the month, will be about 25,000 tests per day, focused on those most vulnerable populations in nursing homes, focused on those individuals who are in nursing homes, who are working in nursing homes, and focused on law enforcement and healthcare workers. What we need to do, though, is we need to greatly expand the sampling. Dr. Duhan has been screaming at the top of her lungs, saying we've needed this for weeks. And I got to be honest, my bias is we really got to focus on rural, because the sampling, if you take a look at the sampling, whether it's nursing homes or you look at the general population, especially in rural California, We don't have the necessary samples to make a definitive decision to go back to some normalcy. So the nursing homes will be first priority. What we're working on then is rolling out in May a larger testing protocol with personnel and supplies. More to come on that, but frontline workers currently in law enforcement, emergency services, healthcare, and nursing homes are our priority at this point.
All right, thank you very much. And if you don't mind, I'll go through the list. Supervisor Jurdy, do you have any questions for Senator McGuire?
I don't have a question, but I did want to just thank Senator McGuire for always being very helpful. Your staff is extremely helpful when I've had constituents contact me about issues, and I really appreciate the responsiveness.
Okay.
No, thank you, Supervisor, and we are grateful to work with you and looking forward to working with you over these next 4 years as well, and promise that we're going to be here now and in the future. Thank you so much, Supervisor Jurdy.
Okay, Supervisor Williams.
Yeah, I have 4 questions. Senator McGuire, how many phases are you hearing?
How many phases?
Yeah, we talk about phasing in business. There's a first phase, there's a last phase. How many are in between?
We have not been looking at it as phase specifically. So here's where we're at right now, and not at all trying to be squishy with the answer. Before we determine significantly loosening up the stay-at-home orders, we have to get a testing protocol in place, which will then be able to tell us how quickly we can loosen up these stay-at-home orders. So some of the work that your public health officer are doing now, what we've seen in Southern California and Santa Cruz County, looking at some of our open spaces and parks, that's lowest hanging fruit. What I think we need to do, and Supervisor Williams, I'd be happy to come back next week to be able to give you more of a firm answer. We got to figure out how quickly we can get testing rolled out into the communities, which then I think we'll be able to talk about how quickly we can implement these phases that you're referring to. So more to come. I promise you, I think we'll have some additional information, but I don't have the specifics on that at this point.
Got it. And if we look at the last phase, based on what we know today, what you're hearing, how distant could that be? Are we talking 6 months to a year potentially to get back?
6 months to a year to getting back to what we would call normal, if you will?
Yes.
Great question. I would expect, and this is my own editorial, this is not coming from the California Department of Public Health. So my own editorial is, I think that the remainder of 2020 will look different than what 2019 did. A few reasons for that. Number one, I think that we're going to look at loosening of restrictions once we get the sampling high enough for testing. I don't think that we're going to see normal seating in restaurants potentially for the remainder of the year. I am not sure that we're going to see the large events that happen, whether it's on the coast or inland, happening this year. There will probably need to be some type of attendance limit. And there will need to be some type of social distancing. As far as county fairs, baseball games, etc., I think things are going to look different. I'm going to go back to what the CDC has told the state and Dr. Fauci. And Dr. Fauci believes that it won't be until the end of the year until we get back to really what we have all believed is normal. And again, the last thing I'll say is we may not see complete normalcy until we actually have a vaccine for this.
Okay, Supervisor Williams, one more question because
I have one. It has a part A, B, and C. Senator McGuire, your office was very quick in responding when I raised a concern of placing signs at our county entrances advising no visitor services ahead. And the goal was to try to keep freedom for the people who live here, public access, and at the same time discourage visitors. And if we can catch them early and get them turned around before they spend 90 minutes driving, perhaps we can have more freedom. And I know Caltrans declined that request. Is there any possibility of bringing that back to the state? It would help us a lot. It would allow us to open up more of our public spaces to the people who live here if we could persuade visitors to postpone.
Supervisor Williams brings up a really good point and something that we're also concerned about. We are very, so just being candid, we're very concerned once coastal Mendocino, coastal Sonoma, and coastal Marin, we relax stay-at-home orders, even if we're just saying for locals to go to local parks and beaches, that we're still going to see an influx of folks from down south. So it is being discussed, even as we speak, about how we message and how we can do this all together. Just stop where you want to be, where your concern, I believe, is just going back to what we saw that first weekend of the stay-at-home orders, where folks just flooded beaches and parks. So yes, and I'd love to follow up with you on that, because that is my personal concern. I know it's a concern of your board. I know it's a concern for Sonoma County and Marin as well.
I'll be brief. We have a broadband grant application pending with the state, and I know you've endorsed it. I appreciate that. As we move through this COVID process, broadband is becoming more critical. We don't want to drop the ball on that, so I thank you. And last, the public has asked me to ask the question, are the inmates being tested before release? We understand California may be releasing 3,500. Is it possible to test all 3,500? And I understand that it's a point in time, may not be 100%, but it would be better than not testing them.
So on the issue of, I'll take broadband and then go to the prisoner piece. Actually, I'll be on a call today with the superintendent of public instruction at 4, along with Assemblymember Wood, on issues of broadband and schools. And as you all know, in a lot of counties, we're at like 30% have access to high-speed internet. In Santa Clara County, it's 89% of the population, for example, according to PPIC and EdSource. So it continues to be a real concern, both community-wide as well as for our kids when it comes to the distance learning. And it's we're solely focused on this in this call today at 4 o'clock. On the second issue of testing, again, I never want to give you an answer that's going to disappoint, but I always want to be honest. I think the biggest challenge that we have right now in regards to testing is having the necessary supplies, both swabs and strips, to be able to test. And currently, due to, look, every state is eating each other alive. We're all chasing the same damn supplies, and this should have been nationalized. Should have been nationalized from the very beginning. Now we're all competing against each other and getting outbid for supplies. So I don't know if it is going to be possible at this point to test every prisoner who is coming out of the system. Does it need to happen in institutions that have hotspots like Chino and Lancaster? I believe it does. But I don't think it can happen at this moment because of the lack of supplies. But the state is focused on ramping this up. Where I do think that we can make improvements is putting protocols, and I'll just speak for myself on this, putting protocols in place of if an inmate is going to be released during some phase of their 14-day quarantine, I believe that we need to be able to provide, for example, hotel rooms, working with state public health to be able to isolate that individual to ensure that they serve out that 14-day quarantine and or we have individualized transportation to get them to their home to serve out that quarantine as well. And that would be just for folks not even who test positive, but that would be for folks who are coming from institutions that have high rates of the virus. And right now, those two institutions are Lancaster and Chino.
All right. Thank you, Senator McGuire. We're going to go to Supervisor Brown.
Thank you, Mr. Chair. And actually, I did speak with the senator very recently over this issue with the release of prisoners. This one from Chino that came to our local community. And he's always open to me. I appreciate all the work that you do, Senator. But I have no further questions. I think Supervisor McCowan asked a question probably before the senator came on about health officers and the governor and who's advising who. That I think he wants to ask, and I think it's important to be asked.
Right, very good.
Thank you. Thank you, Madam Supervisor. And I'll just say, Carrie Brown has just been an amazing advocate for Mendocino County and the North Coast for literally decades. And I just want to say, Supervisor, have loved working with you, looking forward to working with you in the months to come, and appreciated our conversation. Thank you so much.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. First, I just want to echo, it may have been Supervisor Brown, Senator McGuire. As far as I know, you're the most responsive state legislator in the history of Mendocino County. So from day one through to now, and I'm sure for however long you continue to serve, you're always right there for Mendocino County. I'm sure for the other counties in your district as well. Thank you. What Supervisor Brown alluded to, I was saying that there seems to be a bit of a catch-22 in that the governor has said, I'm really waiting for the health officers to tell me how to loosen and how much and what are the conditions. And we hear some of the health officers say, well, we're really looking to the governor because it's his order and we can't be less restrictive than the governor's order. I would hope that the health officers and you would be advocates to the governor for, yes, we have to protect our community and we've been doing a great job of flattening the curve. We don't have a curve in Mendocino County so far. That's wonderful. The other curve we're flattening is that of the local economy. As you're well aware, you hear it everywhere you go. So there needs to be some sort of balance that with appropriate social distancing in place, we have to be able to get our, our small local businesses back up and running while they still can. So we have a situation currently, I can walk into a chain department store that happens to sell food. I can buy a pair of pants, a book, any consumer good under the sun, perfectly okay. I can't go to the local bookstore, the local clothing store, etc. So again, with appropriate social distancing, and I think we know what the keys to that are, we have to find a way to get our small local businesses back up and running. So I hope you will be an advocate for that. I have one other question for testing and then a comment to the prisons. And you don't know if you want me to wait till I wrap up before you respond or one at a time.
Mr. Supervisor, I'll take the testing piece if that's okay with you. And then turn it back over to you.
Certainly. Among the critical groups that you've cited, and I certainly support all of those, we have another critical sector of the population that we're keeping out of skilled nursing facilities because we have in-home supportive services bringing services into their homes. I know our chair and our board are very concerned about the IHSS workers and their clients. I would advocate that we include IHSS workers and perhaps those they serve among the critical groups that ought to be prioritized for testing.
Got it. Thank you. So on all issues of testing and then also the issues of the economy. So first and foremost, the best thing for public health at this moment is the absolute worst thing for our economy. And what we know is, especially in our neck of the woods, our communities are hit harder in times of recession than many of the urban areas of our state. And in fact, Supervisor, I think we can agree we've started feeling some real momentum over the last couple of years with our local economy, and this has been devastating. And talking with folks every day, literally crying on the phone because they're going to lose their business or they're going to lose their home, or talking with a gentleman in Humboldt this morning, can't pay his mom's rent, and she's going to lose her house. So you're right, which is why this issue of testing is so critical. And the public has a right to be upset. Again, though, I want to talk about where we're at and just the challenge that we have, not just in California, but the United States. This nation made some critical blunders in the beginning when it came to testing. Number one, we should have gone with the World Health Organization test. It was ready to go. We decided to do our own test. We then took us about 6 or 8 weeks to do our own test. There were then 2 challenges rolling out the test: contamination within CDC labs, which slowed the rollout, and that went public over the weekend. And then number 2, because of the rush to make these test kits, for example, one of the largest batches that we received from the CDC and the federal government, those test kits came without having 1 solution or 2 to complete the actual test. So where we're at now is we're taking it into our own hands. We can't continue to wait because our economy is going to get is cratering. And the heart and soul of Mendocino County's economy, small business. So I think, number one, the more coordinated that we can be as a region, the better we're off. And I don't ever want to speak for your public health officer. I think she's doing an amazing job, but I'll paraphrase what she said on a call the other day. She said that we need to have better communication with the Bay Area counties, and we need to be able to be on the same page. And we also need to make sure that rural gets what they need to open up. I say all that is, I think it's going to be, local information is critical to opening up. The governor is very interested, as you've seen. The governor has actually lagged a bit behind local counties. The Bay Area and Northern California issued shelter-at-home orders about 48 to 72 hours before the governor did. There's an issue about having local control, but I think we need to be much more coordinated as a region from the Bay Area all the way up through the North Coast. There are calls happening, and Dr. Duhan has said that there needs to be more communication. Again, I don't ever want to speak for her, and she'll tell you this, I believe. There needs to be more communication between the Bay Area and 7 more rural counties in Northern California. And I will definitely advocate for what you had just said, Supervisor, to the governor's office. But I think the number one goal we all must have, we got to get this damn testing regimen rolled out. We have to, because that's going to define what this loosening truly looks like. And that is the number 1, number 2, and number 3 goals for the state this week. Last week is ramping up testing, not just in urban, but in rural. And I promise you, you're going to see some movement here in the coming couple weeks, to few weeks. We're working on it. More to come on that, because we got to get this economy back open, but we also have to do it safely so we don't end up like Singapore and shutting back down. On the issue of IHSS workers, yes, must be a priority, but the challenge that we have is just the number of tests available.
Senator McGuire, I'd really like to thank
Mr. Chair. Mr. Chair.
Yeah, Supervisor McCowan, do you have one last comment? Quick.
And thank you, Senator McGuire. And one comment, I don't disagree with anything you've said. Coordination between counties moving forward regionally, better communication, absolutely. However, our public health officer has reported that the Bay Area counties, at least some of them, have recently taken their discussion into closed session about what reopening looks like, if I'm interpreting her comments correctly. So that actually is a limiting factor. So perhaps to the degree you have influence with some of the other county leaders in your region, perhaps you can help resolve that. I do want to come back to the release of prisoners. And I think we all agree that this was completely irresponsible, handled very poorly. You have correctly identified what needs to happen going forward, but I hope you will also put some effort into exposing just how egregious this may have been. My understanding, it wasn't just a random prisoner who wound up in Ukiah or Santa Rosa or Fort Bragg. And the one who wound up in Ukiah, just to put a fine point on it, was placed into quarantine on April 7th, and on April 8th was dropped off at a public bus stop, potentially exposing any number of people as he made his way to wherever he chose to go, because he didn't wind up where CDCR thought he was going to go. But my understanding is that this prisoner was one of a group of 30 placed into a tank, sequentially dropped off in threes at bus stops, and there were multiple groups of 30 as they were being released. And how many of those contained prisoners who had been exposed, who had been under quarantine? It's pretty outrageous. And I think the department so far in their public comments has tried to evade responsibility for what they set in motion that did threaten public health across multiple counties within the state. So again, I very much appreciate all the work you're doing on that, working with our local officials, working with CDCR, but along with fixing it, I really think we need to try and understand just what was the extent of this as a very stark reminder of why this should never happen again. And again, thank you very much for all of your work.
No, thank you, Supervisor. And I'm grateful to work with you and appreciate your hard work, your advocacy day in and day out. Supervisor McCowan, thank you so much. And I'll just address this item and I'll turn it back to the chair quickly. Look, this is not unfortunately, this is not an isolated incident. This has happened in other areas of the state where there have been releases. And there have been releases from 2 prisons where we've had these hotspots, both Lancaster and in particular Chino. I assure you that there is a focus on developing the protocols. Should this have taken so long, Supervisor? No. Do people have a right to be upset? Hell yes, they do. And Secretary Diaz, over the last 4 days, has made himself available early in the morning, late at night. Every time that I've reached out to him, we will be getting on a call with Sheriff Kindle and Sheriff Martin here today. The Sheriff Kindle, has 100% right to be upset. to be frustrated and to want to make change. That is what this call will be about today, and how we can move forward together in the future. And the Department of Public Health on the state side is also very involved on this, and had a conversation with Secretary Ghali earlier today on this exact issue. But Secretary Diaz, who oversees state prisons, has been incredibly responsive and knows that protocols have to be tightened up and, in some cases, unfortunately, developed. More to come on that, and I'd be happy to report back as well. Mr. Chair, I'll turn it over to you, and thank you, Supervisor McCowan.
Okay, thank you, Senator McGuire, so much. I think everyone has the feeling that you really do understand where we're coming from here in Mendocino County, and we appreciate your continued advocacy and strong voice at the state level on behalf of all of us. And we look forward to, we appreciate your call this morning. So thank you very much, and we'll be talking soon. Okay.
Thank you, Mr. Chair. Thank you, Board. Thank you, Madam County Administrator.
Okay, take care. And we're going to take a break right now for 15 minutes till 11:27. All right, so we're on recess.
Hello, board members. One moment, Chair Haschak was having some technical difficulties. He should be back into the meeting shortly.
Hello, this is John Haschak.
I hear you.
So, am I live?
John, you're live. Williams.
Okay. All right. So sorry about that. I have some problem with my laptop. So anyway, continuing on with agenda item 5A. Let's see. We had no comments from we had one person call in from the public, but that person decided not to talk after this time. So we had a great presentation, and I'm going to, as chair, appoint an ad hoc to deal with some of the business issues and with the West Company and EDFC, that some of the work that they'll be doing with businesses, looking at the limited reopening. And so because Supervisors Jurdy and Williams are on the West Company and EDFC boards, that I think it's appropriate for them to be on it, even though I'd like there to be geographic balance. But since they're on that, I think it's most appropriate not to have any NAC violations. So I'm going to make that appointment as an ad hoc.
Mr. Chair?
Yes, Supervisor Brown?
Thank you, sir. I believe that Supervisor Williams and Supervisor Jurdy will be very dedicated. I'm not worried about, geographical location, because as county supervisors, we represent the county as a whole. So thank you.
Okay, very good. And I forgot to go to CEO Angelo, who had something to say before Senator McGuire got on. So I'd like CEO Angelo to speak.
Thank you. Thank you, Chair Haschak. The only thing I wanted to comment on was the fiscal update that Deputy CEO Antill gave to the board. I wanted to just clarify that on May 5th, we are coming forward with a budget presentation. And given the information that you received today, regarding a revenue projection for this year that we're currently in of $4.5 million less than what we had anticipated, and also where the deficit is, along with additional expenditures that we anticipate at least for the rest of this year. I believe that the May 5th board presentation will include a list of areas for potential reductions within the county system. Now, one thing we all know is that that our auditor, usually at the end of the year, does come up with dollars. Usually the departments don't spend it, or we haven't been able to hire, or there's some issue there that allows us to have a more of a reserve at the end of the year than what we had anticipated. So even though right now we're looking at 4.5 million, it's quite possible it won't be 4.5 million. But what we do know is moving forward, and all of our consultants that have been working with us on our tax dollars are saying the same thing, that it will be 5 years before our finances go back to fiscal year 18-19 levels. So I believe that moving forward for this budget development, and most likely the next couple years, will be more of an austere budget. I can't even believe we're in this. For those of you that were here for 09, 010 and remember the challenges that we had, I think we're right back there. So I just want to bring this to the board's attention. There were no questions about Deputy CEO Antill's presentation, which was fine, and we could certainly talk about the budget more so in May. But I am, as your CEO and as your Chief Financial Officer for this county, I have to say I am very concerned about our budget, very concerned about the reduction in revenues as well. And, you know, we know what that means. So I also want to just let you know that we have our Measure B committee meeting on Wednesday of this week. And I have to applaud the Measure B committee for moving forward with a meeting at this time. And I think it's good because there are a lot of projects that are in the works. But what I'd like to let this board know is that, as I'd mentioned earlier about behavioral health, the warm line, some of the things that are occurring, we know we have a public health event, and it is followed by an economic downturn, somewhat of an economic disaster, along with some an increase in mental health issues throughout the community. And so I am I'm doing an update to the Measure B committee on our COVID-19 response, and then asking the Measure B committee if they would consider making a recommendation to the Board of Supervisors to take some of the money that's sitting there and put it out to our community-based organizations, including the community clinics that are currently serving mental health clients and others that are going in for support or mental health services. So I did want to make that point to the board. And that's really all I have to say, except next month we will be dealing with some serious concerns about the budget and all of the areas that we talked about in the past that we did not move on as an administration or as an elected body. I believe those decisions will be in front of you again. So thank you, Chair Haschak. Thank you to the board.
All right, very good. Are there any questions for CEO Angelo?
Mr. Chair, I'll defer.
Supervisor McCowan?
Oh, I thought someone else was trying to get in. Well, with regard to the projected downturn in revenue, including over $2 million in discretionary funding, and the ramp up in expenses, which we know from experience we're unlikely to be fully reimbursed. I think, unfortunately, we really need to start looking at implementing some austerity measures sooner rather than later. And, you know, I don't have a clear picture exactly what that might be, but I would hope that the CEO and her budget team would be brainstorming that. Obviously, we really don't want to be going back on any of our commitments to our employees. And yet, I think we have to start implementing strategies. So hopefully that can be subject of a near-term meeting, and I think that's what I heard. I'd like to go back briefly to the public health officer's report and the general COVID report. I did throw out the suggestion that local chambers of commerces could be invited to be stand-ins for small businesses that don't have industry associations to help develop appropriate protocols that could allow them to reopen. So if our public health officer is still on the line, perhaps we could get a reaction to that, whether that's considered appropriate. The issue of timelines for reopening has come up. We don't have time today, I suppose, but that really does require, I think, a robust discussion. We are, going to be learning more shortly about what reopening might look like. But one thing I heard, no large gatherings, through Senator McGuire, and I appreciate his candid assessment that the balance of 2020 isn't going to look anything like 2019. So, for instance, county fairs are really, I think I'm hearing, unlikely to be held this summer or fall. And if that's the case, I think it's in everyone's interest to confirm that sooner rather than later, so word can be put out, remove the uncertainty, people know what the reality is, they can plan for it. They'll be in a much better position than if they keep limping along hoping that certain things are going to happen. when they clearly aren't. So, general discussion of timelines. And then again, my suggestion of let's really be pushing the social distancing requirements and highlighting that hopefully on page 1 of the order in a text box, laying out the several key elements of social distancing. Because really, I go out there in the community, whether I go to the grocery store, the chain department store, it's very haphazard. Half the people are not wearing masks. They're not mindful of keeping the social distancing, even when it's feasible. We really need to get the social distancing message across. Thank you.
Okay, thank you. Are there any other questions or comments about what CEO Angelo said? Supervisor Jurdy.
So I just like to hope that we won't be looking at significant changes to the county organization necessitated by this. But I do think that we need to keep in mind that the sooner the county acts, whether it's fully implementing the authority that the CEO has in the flexible hiring freeze, et cetera, the less painful the any cuts might be. So promptness reduces the pain.
Supervisor Williams.
No, I agree with everything said so far.
All right, and Supervisor Brown, did you have a question or comment? Or
not any other than those that have been made. Thank you.
Okay. Okay, very good. So I hope it's all right with Supervisors Williams and Jurdy to appoint you to the ad hoc to deal with the West Company and
yeah, I would accept that. And the two of us have been working with West already, so it'll be a continuation of an effort underway.
Right. Okay, very good. And I hope that the West Company does do the supervisorial district outreach and to all businesses in all the districts. Okay. So with that, are there any other motions or action that we need to take as far as item 5A? Hearing none, we'll move on to item 5B. And we're, so agenda item number 5B, notice public hearing, discussion and possible action, including adoption of resolution amending Exhibit X, master fee schedule effective July 1st, 2020 for the Department of Health and Human Services, Environmental Health Division, Planning and Building Services, and for the Department of Animal Care Services. The sponsor is the Executive Office. Clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, I'll open the public hearing and announce the hearing procedures. The board and or clerk will note correspondence and telephone calls received. Clerk?
All written correspondence has been uploaded to the item, and no additional telephone calls were received.
Okay, and so now we'll hear a staff presentation.
Chair Hashtag, member of the board, this is Darcy Antle, Deputy CEO. We bring to you today pursuant County Policy number 47, the master fee schedule. At this time, we are asking your approval to reduce or eliminate fees for 3 departments. You will see in attachment 3 to your agenda item. It provides an overview of these asks, as well as the department directors are on the line to answer any questions you may have. And again, these are all done based on efficiencies, consolidation. The departments went through and reviewed their processes in order to either eliminate or reduce the fee.
All right, so is the Director of Environmental Health on the line?
Yes, Chair Haschak, this is Trey Strickland with Environmental Health.
Good morning.
Morning.
Is there anything you'd like to comment about your fees?
Well, I have Kirk Ford with me with Environmental Health, and we have a number of fees from our different programs. I'll just mention a couple of the fees for land use, the non-standard sewage system monitoring inspection. We haven't conducted one of those inspections in over a dozen years. That was privatized to our site evaluators, and they do that work. They're able to do it for a lower price than the county does. So we just refer all of our constituents for that service to them. Our large retail market fee and the other land use fee, the coastal development permit application review, just efficiencies in implementing our programs. For the large retail markets, over time, they've improved their food safety practices, and they have newer and easier, their equipment is newer and easier to monitor, and that helps speed up our inspections. And so that's why we have a couple modest fee reductions. And then I'll let Kirk Ford explain the changes to the fees in our hazardous materials program.
Yes, good afternoon almost, Chair Hashtag, members of the board, see you, Angelo. My name is Kirk Ford. I'm your hazardous materials program manager. And so before you've got a couple of different reductions, part of our fee reductions that we were looking at. We didn't just look to reduce fees. We were actually doing a deep dive into how long it took to do the work required with all of these services that we provide. We haven't looked at the monitoring well construction fees and the borings for some time. We didn't look at them in the last update as far as our fee increases. And we really wanted to kind of go back to the drawing board and figure out where can we find efficiencies? What work are we doing here, and where can we kind of triage work to where it's maybe more needed? So as I got together with my staff, we looked at what that would entail, how much time it takes to do each item, where can we kind of trim the fat, so to speak, and we identified these efficiencies, which came out with some rather large reductions. These reductions will also be reductions in the work performed by county staff to visit these facilities. And by, well, I guess they're not really facilities, but by visiting these processes. So most of them are permits to do destructions or constructions of either monitoring wells or soil borings for plume modeling of contamination that's already exists in the ground, or to identify slopes or other water conditions that are going on. These aren't drinking wells or anything, but what we're seeing is that we'd like to encourage that behavior, and we also have noticed a trend of very high professionality with our contractors. So looking at that, we're going to reduce some of our staff time to go to these drillings. We'll see a few of them, but if they're going to do a lot, we're going to kind of take their word for it. And if we have complaints, we'll go check on them after the fact. And so that results in a reduction of time spent and a reduction of money. So that's largely why you see these reductions is we looked at everything that was required on those monitoring wells. Trent?
Okay, thank you. Rich Molinari with Animal Care and Control.
Right. It's okay.
Like to say
Rich Molinari.
Yeah.
Rich Molinari here. Good morning to the board and to the CEO. All three of our reductions in fees were due to Animal Care Services finding a cheaper and effective alternative option with industry competing companies, which ends up saving the county and our customers money. So that's why those decisions were rendered.
All right, very good. And Brent Schultz with Planning and Building Services.
Good morning, Chair Hashik, Supervisors, CEO Angelo, and County Counsel Curtis. Brent Schultz, Planning and Building Service Director. We have two fees, a new reduced fee for a home occupation permit, and that'll be down to $180 $180. So that'll be significantly less than our current business license fee of $339. And then we have a Mendocino Historic Review Board sign copy change for a single business sign, which would reduce it down to $250. It's typically double that, but we've got new streamlined processes for both of those. We think we can do it for less money. And that concludes my presentation.
All right, very good. It's very good news to hear that we're streamlining the processes and reducing the fees. So are there any other comments from the Board of Supervisors?
I have a couple comments.
Okay, Supervisor Williams.
So I brought this up several times in the past year that in the Mendocino Historic District, having high fees and no enforcement, you couple those two together, you encourage people to violate the rules. Where the permit costs more than the construction, more than the sign, more than the remodel, and there's no enforcement, people will just go ahead with the work. That's a real loss to the county. The town we talk about economic development. What can we do to boost revenue? This town brings in millions of dollars between sales tax and bed tax. I think the reduction in the signs is a really good move. I fully support planning. It'll open the avenue to people actually going through the process. I am concerned that the paint color is still an expensive process. Maybe planning could talk a little bit about that. Can we have next steps to do an audit and figure out how much staff time is involved? And it may be that we need to reduce the work that we engage in. My understanding is it's over $700 to get a permit to change the color of paint.
All right. So,
and then I have one last. Do you want me to wait or go ahead with all?
Well, if it deals with the fee reductions that are being proposed, go ahead.
Yeah, the home occupancy. We had direction to staff. It's an item I brought forward. I think it had. Well, I thought it had unanimous support, but it certainly passed last year. It was about removing the plan checks altogether for home-based businesses. And the examples given were a watercolor artist, somebody who writes manuscripts. There are businesses where there are no employees working on site. The public never steps foot on site, and yet we put people through a plan check. Given that we have a shelter in place, and in some cases that may be standing off and on for more than a year, I think we need to be doing everything in our power to encourage home-based businesses. We need this economic activity. And so I would like an update on the concept of removing the requirement entirely from business licenses. I understand Lake County does this today.
Well, right now we're dealing with these fees. So
this is one of the fees that was discussed moments ago.
Okay, Director Schultz, do you have anything to say to that?
Well, this is Brent Schultz, Planning and Building Services Director. We are working on a response to the board's direction on business licenses. We've met a couple times now, and when we have an opportunity, when the board agendas open up, we do have a new process we'd like to discuss. But right now, we don't have that ready to go, but we will have that soon.
Okay. I can support that with the home occupancy changes coming back. What about the paint color, the $700?
This is Brent Schultz, Planning Building Service Director. I have had ongoing dialogue with the Mendocino Historic Review Board on that. They did just change their process on that and did streamline it a little bit. I think we could maybe go farther with them, but we need to get in there and work with them a little bit more on that. So I can tell you there has been some changes. I think they were good. They didn't go as far as I would have liked, but I need to work with them a little more on that.
All right, thank you. Any other comments from the board about the fees schedule? All right. Are there any public comments? Clerk of the board, have we received any public comments on this?
No public comment received.
All right. Okay, so I'm going back to the board and I'm going to start with any final comments. Supervisor Brown?
None, thank you, Mr. Chair.
Okay, Supervisor McCowan?
We may be at that point where I would move approval of the recommended action, and I appreciate the work of the department to reduce the fees.
Well, we're going to hold off on that.
We have to close the public hearing first.
Right. So, Supervisor Jurdy.
No comments at this time. Thank you.
Okay, and Supervisor Williams?
Yeah, I support it. It's a move in the right direction. I just want to leave the door open to there's more work that needs to be done. And some of these items I had been asking for a matter for months, and I heard wait for the fee hearing. And so as we move forward, I don't want to hear, we already had a fee hearing and we passed it, wait for the next one. There is more work that needs to be done specific to the town of Mendocino. That said, I support these changes, and I would second Supervisor McCowan's motion subject to closing the hearing.
Well, all right, and I agree that I approve of these, the move in the right direction with these fees. So I'm going to close the public hearing, and we'll now look for a motion. Supervisor McCowan, would you like to make a motion?
Yes, Mr. Chair, and I also want to second Supervisor Williams' notion that there's more work to be done, and I think that's across the board with what has been forced upon us. More people working at home, more people working online. To me, it all argues in favor of we have to become more efficient at everything that we do in order to better serve the public and help contain costs. So, I think that's the direction we have to move in. I think this is a modest step in the right direction, and I do move the recommended action. Thank you.
Second.
All right, it's been moved and seconded. So any further comments? Seeing none, we'll ask the clerk of the board to conduct the vote.
Sure thing. Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
The motion carries unanimously.
All right, so at this point, we're going to take a 30-minute break, and then we're going to go into closed session, and we're going to deal with agenda item 9 in closed session.
Mr. Chair?
Yes.
I received an email from staff advising us we would be having a working lunch and would work through until 1 o'clock if necessary. And I believe some of our colleagues may have commitments at 1. I'm not sure, but I was prepared to work through to 1 if that's acceptable to the board.
Yeah, that's fine with me. Is it all right with the board?
Yes, I have a 1 o'clock meeting.
Okay, and Supervisor Brown?
That is fine, thank you.
Okay, and Supervisor Williams?
Flexible.
Okay, so we'll continue. Is staff all right with that? CEO Angelo?
Yes, thank you.
We're all right? Okay.
Chair Haschak, if I
Yes.
might, this is Janelle Rao, Deputy CEO. I just wanted to confirm and clarify that the item you're referring to is off agenda. So when you do get to that for closed session, County Counsel is prepared to make those findings, and we'll go ahead and then adjourn into closed session after you've concluded your open session business.
Okay. So let's see. Well, if you're saying that 8B is closed session.
That's correct, Mr. Chair.
Yeah.
8B is a closed session item. Just for the sake of the flow, I would suggest that we hold off on that one. There will need to be a discussion about the board making the requisite findings before we convene into closed session. However, I believe you also have another item for open session, which I believe is 8A, and I would suggest taking that one first.
Okay, very good. All right, so we'll move down to 8A, which is discussion and possible action, including direction to defer without penalty collection of TOT and BID funds due April 30th, 2020 until July 31st, 2020. The sponsors are the Treasurer, Tax Collector, and Supervisors McCowan and Jurdy. Okay, so
Mr. Chair, if I may, as this is an off-agenda item, before the board gets into the substance of the discussion, there will need to be a finding that an emergency situation exists, and this would be related to the emergency as well, and then to take a roll call vote on those findings before considering the substance of the item.
very good. And I think that we've all seen communication about this issue. And so the supervisors have an understanding about what this is about. Could we have a motion to consider this as an urgent item?
Well, Mr. Chair, and I think the urgency is that the returns are due April 30th, so there's a need to take action now. So I would move that we add this item to the agenda for discussion, making the appropriate findings.
Second the motion.
All right, it's been moved and seconded. Okay, and we'll have the clerk of the board do a roll vote.
Sure. Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
Supervisor Haschak? Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
The motion to hear the item carries unanimously.
All right. So the sponsors are Tax Collector, Treasurer, Tax Collector Sherry Schapmeyer, and Supervisors McCowan and Jurdy. So Sherry Schapmeyer, would you like to address this?
Oh, sure. Can you hear me okay?
Yes.
Okay, great. Thank you. Chair Haschak, members of the board. As this board is aware, tourism's a vital component to the economy of this county. Our lodging establishments consistently provide an extremely stable revenue source for the county's general fund through TOT collections. It further enhances our economy with visitors supporting our restaurants. It also creates stable sales tax dollars through visitors spending at our retail establishments. Unfortunately, as nothing has gone untouched by this crisis, along with the subsequent shelter-in-place order, it is possible that ultimately nothing will be more impacted than tourism. Our normally vibrant lodging industry needs our help now more than ever. The third quarter ended on March 31st. Their TOT and bid returns and remittances are due April 30th. And I just want to explain that TOT is different than other types of taxes that my office collects. Lodging operators collect these funds from customers on behalf of the county. Funds are kept separate and they're not supposed to be used for cash flows or cash shortages. That being said, we are in an unprecedented catastrophic time and our lodging operators are getting hit from every direction. A month and a half ago, they were fine and looking forward to their busy spring and summer months. In fact, total TOT collections for the first 2 quarters of this fiscal year were actually up by approximately $200,000 from last year. Now our lodging establishments are upside down. They're having to refund canceled prepaid reservations, which have totally wiped out all their cash reserves. They have no idea when lodging will be cleared to open back up. They also have property taxes, and of course, they have the TOT and bid that need to be remitted. The lodging operators COVID-19 response team have submitted a recommended plan to help the lodging operators deal with this crisis. I have been working with Supervisors McGowan and Jurdy to come up with a remedy for our lodging operators. The balanced approach that we are recommending is outlined in the agenda summary, which is primarily a simplified remedy to extend the penalty date by 3 months. So the April 30th deadline will be moved to July 31st. This enables the county to hopefully be able to collect the TOT and then accrue it back to the 2019-20 fiscal year, which will get it where it needs to really be. Of course, this can be revisited in a couple of months if we need to go that route. That's mostly what my comments are, and I would be happy to answer any questions that the board may have. Thank you.
Okay, thank you. I'll send it off to Supervisors Jurdy and McCowan. Do you have anything to add to that?
I would just add that the underlying issue for me is if some of the lodging operators go bankrupt and their properties are taken over by the banks, the mortgage holders, it will delay significantly the reopening of those lodgings, perhaps by years. And that's really the greater community rationale and reason behind my thinking in why we should defer this.
Okay, thank you. All right. So let's see, are there any public comments on this? Deputy Clerk of the Board?
No, there are none.
Okay, thank you. So
Mr.
I'll invite a motion.
Mr. Chair, if I may.
Just
before the board makes a motion, I have been looking at this item and the possibility that instead of the recommended action talks about an urgency ordinance. I would just ask if the board is to give direction that County Council be given a little bit of discretion, that if we determine that it can be done on an emergency basis with a resolution, that would be what we'd bring forward in lieu of an urgency ordinance.
Very good.
Mr. Chair.
Yes, Supervisor McCowan.
I would certainly support that, and I do believe the item has been well covered by Treasurer Tax Collector Schrappmeyer and Supervisor Jurdy. It's all pretty well explained, I believe, in the agenda summary, and also the action providing County Council does not identify any barrier to doing so. This would apply to lodging operators, but not to third-party agents such as rental agencies, and certainly support the flexibility that County Council has requested in determining the best way to do that. So with that clarification, I'm happy to make the recommended motion.
Okay. Is there a second?
I'll second the motion.
Very good. All right, any further comment? All right, hearing none. Clerk of the Board, could you do a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
The motion carries unanimously.
All right, so.
Thank you.
We will move to item 5D, which is discussion and possible action, including review. 5C, which is the CEO's report.
Chair Haschak, there's no CEO report today. Thank you.
Okay. Agenda item 5D, which is discussion and possible action, including review, adoption, amendment, consideration, or ratification of legislation pursuant to adopted legislative platform. Executive Office is a sponsor.
Chair Haschak, nothing today. Thank you.
Okay, very good. Supervisors reports. So we'll go starting with Supervisor Jurdy.
Just briefly, Supervisor McCowan and I met with separately, as a group, we met with county staff, city staff, and council members in Fort Bragg. And then separately, we had a meeting with City of Ukiah about the homeless issues relevant to both areas. And we have plans to meet many follow-up meetings with both groups. Thanks.
Okay, Supervisor Williams.
Nothing essential.
Okay, Supervisor Brown.
Yes, the Behavior Health Advisory Board met last Wednesday. It was via Zoom, and nothing significant to report. There was a special meeting called for Area Agency on Aging, and the governing board approved funding, extra funding and advance funding for all the senior centers that are involved in their meal programs. So that was a win-win situation for our seniors and the centers that service them. I also took part in a federal conference call with the top secretaries of the different departments related to COVID-19 and heard their reports. Everything is out now in news releases and what have you. But we heard the first announcements, the whole list of directives and financing opportunities, etc., and also about testing. And then, let me see. I think that's it.
Supervisor McCowan.
Thank you, Mr. Chair. Briefly, some interrelated items. At our last meeting, the board authorized Supervisor Jurdy and I, as the Homeless Action Ad Hoc, to meet with our counterparts from cities of Ukiah and Fort Bragg. We did so. We will be having future meetings. We will have one additional meeting only with Ukiah, and then we expect to be able to have a meeting with all of the ad hocs, potentially inviting Willis and Point Arena to participate as well. The main focus of our first meeting with City of Ukiah was the encampment in the airport clear zone. There are quite a range of issues that were discussed and actions that were identified. But as we all know, the camp itself cannot be moved while we are in a pandemic. But we have strategies to ideally reduce the size of the camp and then try and identify criteria that would lead to justification that it's now time to have those folks transition out of that location, which is inappropriate. Our county staff is prepared to complete screening of the people in that camp who are willing to be screened to try and identify what services are available to get them into a more appropriate situation. Meanwhile, the camp is continuing to grow, and this is something that the county does not have the ability to control. Our HHSA staff and our contractors don't have the ability to tell new people moving into that clear zone that they can't do so. So that's something that city ultimately will need to be responsible for if we're going to actually reduce the size of the camp at the same time as we consider ways to remove the camp. We will, Supervisor Jurdy and I, have another meeting with City of Ukiah this Thursday. We did respond quickly to their request at their council meeting Wednesday of last week. We met with them on Friday, I think it was. No, we met with them on Thursday. Yeah. And so, and we'll meet again on Thursday. So we're devoting time and resources to this, as is HHSA staff. But it's once these large encampments develop, it's problematic on how you can best deal with them. Thank you.
All right, and I attended the Behavioral Health Advisory Board meeting virtually. And also I've just had many conversations with constituents about what's happening economically, but also as far as concern for health. And so I will end with that. We will go off to agenda item number 8B, which...
Mr. Chair, very briefly, I forgot one important thing. The continuum of care will meet today. They will be considering the draft Mendocino County Strategic Plan for Homelessness. I do believe that will assist us in the future in having a more effective response to issues around homelessness. So I think we can anticipate, if the CFC approves that, which I expect they will, it will be coming forward to our board and to the city councils. Thank you.
Is that meeting streamed for public benefit?
I believe it is.
All right, so very good. Supervisor McCowan, where could people find that meeting? Would it be on the?
Well, it should be on the county website.
Okay. All right. Thank you. So off agenda item number 8B, pursuant to Government Code Section 54954.2, pursuant to Government Code Section 54956.9D2, conference with legal counsel, anticipated litigation, significant exposure to litigation, one case. And so we need to establish urgent consideration of this matter due to the timeline, and that's from County Counsel. Okay, County Counsel?
Thank you, Mr. Chair. Just want to note, after the agenda was published, there was a legal threat that came to the attention of the county directly related to the current emergency. I am asking the board to make the requisite findings that an emergency situation exists and to discuss that threat in closed session.
Okay, is there a motion to consider this as an urgent item?
I move we consider this to be an urgent item.
Okay, is there a second?
Second.
Okay, it's seconded by Supervisor McCowan. Okay, clerk, could you do a roll call vote?
Of course. Supervisor Haschak.
Yes.
Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
Supervisor Jardy.
Yes.
Supervisor Williams. Okay, the motion to hear the item is unanimously approved.
All right. So with that, and let me check that it seems like we're ready to go into closed session. We have items 8B, and if there's anything in item 9.
Excuse me. Chair Haschak, I just want to remind everyone to completely log out of this session and log into the closed session for Zoom.
And that was an email sent us?
Yes.
Question?
Yes, Supervisor Brown.
I'm only on phone because of poor broadband, so I just stay on. Is that correct?
No, that's going to be a different meeting, Supervisor Brown. So you can check your email, and there'll be another meeting ID for you to call into.
But
you can do that again. Yeah. Yeah.
Okay, and then at the end of the closed session, are we coming back to this virtual meeting?
Yes, because we will need to report out here.
Right. Okay.
So is there a break between, or is it immediate in?
Well, we can take a 5-minute break. Will that suffice?
Perfect.
Okay.
And one more question, Mr. Chair. For those calling in, I show the same phone number, but it's a different meeting ID number. Is that accurate?
Correct.
Thank you.
All right, good. Then we'll call back in for the other closed session item in 5 minutes. All right. Thank you, everyone, and stay well. And we'll call the meeting back to order. In closed session, we dealt with item 8B, and direction was given to staff. Just like to say, clerk of the board, is there any public on the line right now?
No, there is not.
Okay, very good. And so that's it for the meeting today. Stay well, everyone, and take care. Meeting is adjourned.